going to do is I'm checking my physician's orders against my MAR. I'm looking to make sure that I have the right patient, checking for allergies. I'm looking for the correct rate, dose, and route. And the doctor has ordered ranitidine 50 milligrams, IV piggyback every 8 hours. And that's what it states here on my MAR. Okay, so next I can put my physician's orders up. Okay, next thing, I am going to compare my medication to my MAR. And I see here that I have ranitidine 50 milligrams. It says every 8 hours, IV piggyback. Okay, I'm checking for expiration date. I'm making sure that it's not leaking or cracked. Okay, so the next thing I'm going to do is I'm going to check for, make sure it's the correct dilution, compatibility, rate of administration, dose, and indications, contraindications, and side effects. So my usual dose is going to be 50 milligrams every 6 to 8 hours. And that's what it states here on my MAR, and that's what the doctor ordered. So he ordered 50 milligrams every 8 hours, and it says in my book that 50 milligrams can be given every 8 hours. My dilution, I have, it says it can be diluted with D5W, D10W, lactated ringers, and 5% sodium bicarbonate. I see here that I have 5% dextrose hanging, so that would make my medicine that I'm going to be given, my IV piggyback, and the meds, the fluids I have hanging compatible. Okay, my rate of administration, I'm going to give my 50 milligram dose over 20 minutes. That's the max amount of time. My indications and uses, this is used for gastric ulcers and for GERD. My contraindications, it says known hypersensitivity to ranitidine or its components. I'm going to observe vital signs and pain level. I need to obtain a baseline creatinine and monitor ALT. I need to tell my patient they should stop smoking or avoid smoking after the last dose of the day of this med, and it may increase blood alcohol levels. My side effects, it can cause abdominal discomfort, burning and itching at the IV site, and constipation, diarrhea, headache, and nausea and vomiting. So I would tell my patient that if they have any of these things, that they need to let me know. Okay, so the next thing, I'm going to wash my hands, and I'm assembling my equipment. Okay, so next I'm going to label my medicine, and I'm going to put the date. It's Wednesday, the 10th, 7th, 20, have 50 milligrams of ranitidine. And it's going to, we're getting started. It is 9:44. And I'm going to put my patient's name. And my start time should be 9:44. And my end time. And my flow rate is going to be 38 drops a minute. Or if I had a pump, it would be 150 milliliters. Okay, an hour. All right. So now that I have all of this together, now I can get my tubing set up. know if that my tubing touched anything, you know, I would need to get another set, just for infection purposes. All right. So now I have all of my equipment that I need and ready. All right, so now I'm ready to head to my room. All right, so I got my stuff and I'm headed to my room. Okay, so I'm gonna introduce myself. My name is Amber Jones. I'm gonna be your student nurse today. Can you please tell me your name and date of birth? And do you have any allergies? And I'm checking this against my MAR, making sure I have the right patient, and that I'm checking for allergies. Okay, so the next thing I'm going to do is I'm going to wash my hands, and I'm going to explain to them that the doctor has ordered ranitidine 50 milligrams IV piggyback, and this is given for gastric ulcers and GERD. All right, so I'm going to wash my hands and okay, so I'm gonna wash my hands, and now I need to check for patency of my lines. So I'm going to bring this down, and I'm checking to make sure that I get good blood return, and I'm looking for any type of infiltration around my site. Okay. All right, so the next thing I'm going to do is I'm going to clean my port for 30 seconds. Okay, and next I am ready to drop my primary bag down. And I'm ready to attach these two. And now I need to get my second hand watch. And I am ready to regulate my drops. And I need to open my secondary line. And also, before I get started, I made a mistake. Well, no, I didn't. Okay. When I open up my line here for my my secondary line, I should have put this one over here. I'm gonna change this and put it over here just so I can see. Okay, so I'm getting 38 drops a minute, and I'll let you know when I'm ready to get started. And start. 1. Oh, okay. Let me start over. I'm starting over. And start. 1, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 9, 30, 31, 32, 33, 34, 35, 36, 37, 38. Okay, so now that I have regulated my drops for a full minute, I would reinforce my patient teaching, tell them that if they have any type of constipation, diarrhea, nausea, vomiting, to let me know. I'm going to clean up all my equipment, and as the piggy bag is done, I'm going to take it down and I'm going to put my primary fluids. So I'll take this down, close this off, unhook this, and of course, before I do this, touch it again, the lines. I'm going to wash my hands because I don't want to introduce any infections. So, all right, so now I can disconnect my tubing. Okay. And I would discard it in the proper location, and I'm going to put my primary tubing back up to where it's supposed to be. Back up to where it's supposed to be. And whatever it was running at previously, that's where I'm going to put it. And I'm going to do my documentation. I'm going to explain that I done my patient teaching. I told them what it was and what it was supposed to do. Let's see. I'm going to document the date, the dose, route, time of the medication, what it was given for, and how the patient tolerated the procedure.